This page will be based more on empowering individuals and families in protecting themselves rather than based on government restrictions. We can do this because we are significantly declining the activity of the virus in our state. This is good news. Earlier today, Washington joined both Oregon and California in announcing a shorter timeline for lifting the mask mandate, including in our schools. So after March 11th, the vast majority of businesses and public spaces will be free of a mask mandate, and that includes our schools in the state of Washington. Here's why we're doing this. First, I want to show you our epi curve. If we can have the epi graph, please. You'll notice our epi graph has shown a very significant decline in the last month, and we have seen a consistent level of reduction, which has continued in the last couple of weeks, and we're very pleased about that. Obviously, the virus is still active in our state, but we are confident that that decline will continue, which allows us to make a decision today to accelerate the date when our mask mandate for schools will be accelerated. Okay, next slide, please. So now let's look at our hospitalizations. And our hospitalizations are coming up. Here they are. As we know, hospitalizations have followed the infection rate by some period of time, but they are also coming down quite dramatically. You'll note that where we are today at the far right of the chart, which is 147 for a 7-day rolling average, is still high relative to the other peaks we've experienced. But again, the rate of decline is very significant, and given the fact that this has been the pattern across the world, really, we are confident that we can accelerate our demasking protocols, if you will, going forward. So that is also good news. We want to again thank our folks in our hospitals who still are working very hard, because our hospitals are still very busy, and they're continuing to do really hard work, including getting more people who've been waiting on their elective surgery. So thank them. But we're happy that these numbers continue to come down. Okay, we can go forward. So we've continued to see cases go on. We can take down the graph. We're also seeing hospitalizations decline in the last 2 weeks. This is important because we've continued to see this rate of decline, which has been important in our thinking on this. As you know, last Friday, the CDC released new guidance regarding masks, and that has had a significant impact across the nation, obviously. Our office and our Department of Health experts have now had a chance to look at the recommendations that they posited. And I think the CDC guidance reflects my view and our department's that we should be transitioning to a new phase in our efforts against COVID that particularly focuses more on our hospitalization rates, and obviously that's coming down sharply. And so this is why we've been able to loosen several of our requirements related to gatherings, vaccinations, and now masks. Now, the CDC presents 50 state data a little differently than we have been reporting our data. But today I'd just like to focus on the CDC's methodology and how it has moved our thinking. For 2 years, we have consistently relied on our state DOH data for the most accurate understanding of the pandemic in Washington state. But we've also considered CDC guidance as well in any new thinking on this subject. So let me just share what the CDC reports today for our state. The CDC sort of breaks up a combination of infection rates and hospitalization rates into 3 categories of activity: low, medium, and high. This shows our counties as the CDC would classify them today, with the yellow being low, the green being medium. Excuse me, I've got those backwards. Thank you very much. The low being green, the medium being yellow, and the orange being high. You note that we still have distinctions in our state. Pierce County remains high, even though King County is in low. But we need to look at this on a statewide basis. We think doing this just on a county-by-county basis has not been helpful in the state of Washington. So we want to move forward as a state at the appropriate time. And we think that is the best route forward for the state of Washington. So we have good news that we're going to continue to see, I believe, rapid declines in cases and hospital admissions. We can take the graph down. Based on their data, I'm confident that March 11th, we will be out of the high-risk category as a state. And that's how we thought about this. So we believe we'll be out of that category where the CDC would recommend masks by March 11th. Now, I do want to note that our hospital rates are down, but again, we think there's a reason for people to be careful, obviously, in part to help our people working so hard in hospitals. We are still bouncing back from the Omicron surge, so we're ready to lift this mask mandate on March 11. But we don't think it would be the right decision to do that earlier, given the need to move forward as a state. Now, additionally, in the coming days, we will be announcing what we think of as our next chapter on how we deal with this virus. We believe that this will be based, as I've indicated, on a provision of empowering individuals and families to protect themselves rather than having mandates. And we know that we are certainly going to continue our very vigilant and resourceful and dedicated efforts to protect our people from this virus. So our next phase in planning will involve commitments on multiple levels, and we'll talk about that either later this week or early next week. That's going to be a plan that will assure that we have adequate availability of vaccination if another variant comes back, that we have adequate PPE if another variant comes back, if we have adequate medical care if another variant comes back, as well as planning for a future in a whole host of endeavors. And I look forward, we'll have that plan, as I've indicated, later this week or early next week. It's important to note the date does not change any other aspect of the updated mask guidance that we earlier talked about. After March 11th, masks will still be required in certain settings, high-risk settings, healthcare facilities, corrections facilities, and long-term care facilities. So we'll look forward to continuing that work. So we know we're going to continue our efforts. They will look differently now as we move to this next chapter, but they will continue to be protective. So our commitment, our level of commitment is not going to change, but this virus has changed, and we're making decisions to act appropriately on those changes. It's also important to realize as we go forward, a lot of folks are going to want to continue to wear their masks, and we are going to continue to protect their right to do so. So our order will continue to assure that people can wear their masks on the job if they desire to do so. And importantly, students will be able to wear their mask should they and their parents desire them to do so. And I do note that because I do think it will be important for us to protect these children so they don't end up being teased about it if they do want to wear a mask. And I'm confident our educators will handle that with the compassion that they have to date.